Let's talk about MyChart. During this webinar, we're going to have everyone's mics turned off. Any questions, you can go ahead and enter them in the chat in the Q&A area, and we will go ahead and answer during this webinar or at the end. So go ahead and enter your questions if you have any through this slideshow. Today's agenda, we're going to hit 3 different areas when we're talking about MyChart. Number 1 is MyChart basics. Number 2 is scheduling your own appointment via MyChart. And 3 is messaging your care team or primary care provider. If you do not have a phone or don't know how to download the app on your phone and you are mostly computer savvy, which is a desktop, when you log on to our onecommunityhealth.com website, you do have the MyChart icon on the top right-hand side of your screen that you're able to log into MyChart. Now, if you have an iPhone or an Android, you can download MyChart through your mobile app at Apple Store. And you can see on the top left-hand side, you see what the icon, what the visual would look like on your phone. And if you have an Android, you'll download the app via Google Play, which you'll see on the bottom left-hand side of the screen. Once you've downloaded the apps and you're able to successfully log in, this is kind of like the visual that you'll see either on your phone and on your desktop. The first one would be on the top right-hand side. The top left-hand side, you'll see the little house or the number 1. That's the main menu. We're going to also talk about the welcome, which is the quick access button. Number 2 in the center of your phones or your desktop. And number 3, which is your profile and settings. And we'll get deeper into that through the slide. Now, the main menu. In the main menu, as you can see the arrow pointing down on the 3 lines, you'll see the options that are available to you. You would click on main menu, you'll find what you're kind of looking for. If it's visually not there, you can actually type it in as well on the search tab for an easier find. Like the table of contents, like view care team, messaging as well. Now, the quick access buttons are located in the center of your screen on your desktop or the screen on your phone. With these, quick access button, you can schedule an appointment without having to go through the main menu. You can schedule an appointment, message your care team provider, go into your visits, review your results, medications, and also view immunizations. Now, lastly, the profile and settings, which is on the top right-hand side of the screen. It should have, if you have a picture, your picture of yourself, or it could be your, your initials, first and last name. This is where you can actually access if you have multiple people on your account, your children, a significant other, if you have proxy, you have authorization to be on their account, and you can actually manage them here. But you can also update your personal information, change your password, change language, and like I said, manage family access and log in and log out securely. The most important thing to remember is that in the main menu, you'll find all available options that we offer in MyChart. Also in the quick access buttons, the fast button to, schedule an appointment, message, view test results, medication. Also on the profile to access or manage your account. So if you are requesting a proxy access, to one of your child's or significant other's account, you can actually manage it through your profile. So Like it says here, MyChart is designated to make and manage your healthcare easier. Start with the basics, messages, test results, and appointments, and you'll be using MyChart like a pro in no time. Schedule your own appointments. So the next couple of slides we're going to discuss how to kind of schedule your own appointments using MyChart. If for whatever reason you run into any issues, you're always welcome to call our main line to schedule an appointment, which is area code 916-443-3299. Now, to schedule your own appointment, you're going to log into MyChart. You're going to schedule an appointment, which is on the quick action buttons. You're going to click on schedule appointment. Choose your provider or the visit type that you want to schedule. If you do not see your provider on your MyChart options, you will have to contact the clinic so we can make sure to add your provider on there. Once you select your provider or the visit type, then you're going to follow the next steps. You're going to complete the questionnaires. When scheduling appointments, you will have some question might not on all visit types might have some questionnaires for you to complete before moving on. You're going to answer each question. For example, have you traveled recently or do you have a fever? Once you've addressed those questions, you're going to hit continue. You're going to pick a time that works for you, view the appointment, the available appointments, choose a date and time that works for you, pick the option that fits your schedule, and if you need more options by updating your search, update your search by changing the clinic location, the healthcare provider, or date range. Review your appointment details. Check the date and time, confirm the location. You're going to add your reason for visit and share any important details in the comment section. Then you're going to click schedule appointment. Review your confirmation in MyChart. Then you're going to get as you can see on the right side of the screen, you're going to get the appointment details. It says that your appointment has been successfully scheduled. From this screen, you can view your appointment details, change your appointment, cancel your appointments, complete forms before your visit to save time on the day of your appointment. And then if you find yourself that you're unable to see or schedule successfully your appointment, you're more than welcome to give us a call to the clinic and we'll have one of our call center representatives to assist you. You may call area code 916-443-3299 and we'll gladly help you schedule your next visit. Now, the next slide, we're going to discuss how you can message your care team. Okay, which means that you can message your caseworker, your provider, or anyone that's in your, again, medical care team. You're going to sign into your MyChart. You're going to click messages. Click send messages and select ask medical question. This is an important reminder. Use MyChart for non-urgent questions. You're going to dial 911 or go to the nearest emergency room for urgent care. Choose a type of message. So select the options that best matches your needs. For non-urgent medical questions, prescription refills or medication questions, questions about test results, questions about your previous visit, or COVID-19 test result. Once you've selected your the questions, then you're going to select your clinician. You're going to pick the right message type to get faster response. Use MyChart for non-emergency questions. Call 911 or go to the nearest emergency room for urgent care. Write and send your message. So enter a clear subject, write your questions or concerns, add a photo or a file if needed, and then click send. For example, your subject will be knee pain. Your message will be, I have had pain in my right knee for the past 3 days. Should I schedule an appointment? After you send the message, we'll wait for a response. You're going to see your messages in the conversation. Watch for a reply from your care team. Get a notice when a response is ready. What happens next? You can come back at any time. Read messages from your care team. Reply with the questions or updates. View your message history. Responses may take up to 48 hours and are not always reviewed on evenings, weekends, or holidays. Thank you for using MyChart. We are looking forward to seeing you at your next visit.